You know, there's absolutely no educational requirement connected with a DEA license to write prescriptions for these opioids. Doctors are not required to have any continuing medical education on this topic, and as a general rule in our medical schools across the country, it is not a required course of conduct, a course of education, to get a course on opioids and their effect on humans. So who are doctors getting the education from then? From the pharmaceutical companies, who make these drugs and profit from them. And I'm not saying there's not a use for these medications, there are. But we are using them much too broadly, much too extensively. And I would rather believe that this is just a lack of education on the part of our medical community. The alternative is too unthinkable, that doctors and pharmaceutical companies would be poisoning the American public for profit. So I believe we have to educate our medical professionals more so that they understand exactly the effect that this type of medication is having on people over the long term. We also have seen success on alternatives to opioids coming from places like St. Joseph's Hospital in Patterson, where they have now geared a program to prescribing alternatives to opioid pain medications for patients through their alternative to opiates program. Really important, they have seen enormous success in their emergency room at St. Joe's. And we are urging, and we'll use the National Commission to urge other hospitals to look at programs like these that takes opioids out as the first option and looks at other alternatives to pain management to be able to deal with it. We also know that we shouldn't have people locked at the doors to our treatment centers around the country. And that's why in the law that we just recently passed, we said no pre-approval. That can take weeks to complete for admission to a treatment center. And no evaluation for 180 days of treatment. We do not want insurance companies to be the reason that people are not getting treatment. Our Medicaid population, after we expanded Medicaid, is getting more drug and alcohol treatment today than any time in New Jersey history. The wealthy have always been able to afford whatever coverage, whatever kind of treatment they needed outside of their insurance coverage. The folks who have really gotten squeezed in this instance is the middle class. People who work hard, usually get insurance through their employer, have coverage for this, but get roadblock against roadblock against roadblock from the insurance company. And we're trying to push that away in New Jersey, and something else we're looking at the national level as well. We're also looking to bring the whole country together on the prescription monitoring program. Now here in New Jersey, we now share our information after an announcement next week with 12 other states on a real-time basis. 5 states just joined last week. And with that total now up to 12, the numbers are pretty startling if you look at them. We've got Pennsylvania, Maine, Massachusetts, New Hampshire, West Virginia, New York, Connecticut, Delaware, South Carolina, Rhode Island, Virginia, and Minnesota are all now sharing their information with New Jersey and we with them. Over 1 million data requests between New Jersey and our interstate partners so far in 2016, or in 2016 rather. That was a 512% increase from 2015. Over 1 million requests. During the first 5 months of 2017, we have already had 824,000 data requests in the first 5 months. We're over 1 million, a little over 1 million all of 16. 5 months of 17, 824,000 requests between New Jersey and our interstate partners, a 274% increase from the same period in 2016. That's all 512% increase over the year before. We see the trend. And by the way, January through May is without the new partners that we added. So we're going to see a geometric increase. Why is this important? We're expanding patient history searches to help ensure people are treated before it's too late, and to provide physicians with 2 years of a patient's prescription records, a year more than previously allowed.